Joining us now is Professor of Political Science at Cypress College in Los Angeles, Peter Mathews. And Professor, you would have seen that story. Look, attitudes are starting to change here in Australia. We've gone through quite a challenge, and the amount of people that were sort of very cautious about the vaccine, saying I would like to wait, are now starting to listen to all the epidemiologists, the doctors, the scientists, every eminent person that wants to get on the front foot and tell you they're completely safe. But this is a real issue, a big issue in parts of America.
It is a huge issue for the entire country, although it's focused on parts of America because the whole country will suffer. And in fact, other countries have gone ahead of us in vaccination rates because of these recalcitrant people who don't want to get vaccinated by any means. And they're really working on getting that done, because if we don't do that, it's going to spread. The variants can develop, more variants can develop. You know, we've gone from 27,000 positive cases in one day in July the 6th. July 30th, which is yesterday, we are at 122,000. That's a 450% increase in actual cases per day. So it's just skyrocketing, and this has to stop. And the unvaccinated they have to be educated or somehow convinced through example or what have you, to at least get 85% of Americans vaccinated.
We saw a chilling story here on Weekend Edition yesterday where a reporter was in Florida and basically going from patient to patient and speaking via a phone and many times young people, and saying, would you have been vaccinated? And every single one of them, look, because they just don't know. They're getting all this other misinformation and saying, I'm not going to get vaccinated because of this, this and this. Social media and the access to information and wrong information is very dangerous.
It is hugely dangerous, and you're right. They're so influenced by some of these social media disinformation. It's becoming a national security issue. I don't want to put it in stark terms, but it can actually very well be that, because if the U.S. doesn't get this together and get these folks vaccinated, we're going to suffer a breakdown in health, deaths, and devastation, but also the economy. The economy will not be able to flourish. The extraordinary economic growth rate is already starting to stabilize and not go up any further because of the threats of this happening, of people not being able to go to work or go to school without vaccinations. And then masking is another issue we should talk about as well. Masks are important as well.
Well, tell us more, because that gets to Joe Biden and some of his rhetoric during the week. Not just rhetoric, they're going to put it in place as law that they'll be mandating lots of stuff, obviously masks, but they're going to be starting to mandate those vaccinated are the only ones that are going to be able to work in certain environments.
Yes, all federal employees will have to be vaccinated according to his mandate that he's putting forth for them. That's about 4 million Americans who work for the federal government. If they don't get vaccinated, they have to have proof that they have to have testing regularly every week, be tested to show that they're negative and not positive, and they have to wear masks. Now, the CDC did change its mind when it came out with a study which showed that even a certain percent of those fully vaccinated can actually come down with COVID infection, but not be in hospitals or in death easily, because it's very protective, and yet they can also spread the infection. So now there's universal, at least in the states and the counties where there's a percentage, it's what's called a rate of infection. If it's at either what's called substantial or what's called high rates of infection, which is 2/3 of the counties, you have to wear a mask indoors, and that includes Los Angeles County, where I live. So that's being also mandated by this. It's been recommended by the CDC, which is a very strong recommendation. Other places like the state governors and other state institutions will actually take the step forward in that direction, because CDC has actually verified that it should be done.
A lot of the anti-vaccination is coming along political lines as well. That's what some of the evidence is coming out as.
And that is a real tragedy, because this is not a political issue. It should not be a partisan issue. It certainly is the sense that it's a community issue. It's certainly the whole polis, the whole group, the community should be in the nation should be involved in this in a concerted effort and not be divided along party lines. But that's not the case. Unfortunately, there are partisan divisions here, and they've been using it for political purposes in the worst possible way to make political gain on the part of certain members of Congress, certain politicians who want to get more votes that way, and to show that they're loyal toward what they perceive was Donald Trump's adamant anti-masking rhetoric. Even Trump, though, has come out now and said vaccinations are important, go ahead and get them. He said that, but he said, I still respect your freedom of choice. So he kind of, waffled on that whole thing. I wish he would just come out firmly and say, look, this is a vaccine which I was involved with in promoting, and I got it funded, and you could call it the Trump vaccine if you have to, but go ahead and take it. Please take it, everyone.
Yeah, he doesn't want to upset some of his more right followers, I'm sure. But there is another issue. There's an underlying issue, particularly in the United States, where you've got working class people who have got no support to even go away and get the vaccine. There's an issue there because they are living hand to mouth, basically, and there needs to be things catered for those types of people, those people who are just basically on the breadline.
Absolutely correct, Tim, because this has become a class issue which has been exacerbated by the COVID virus. Because, before that, there was a lot of class divisions in America, rich and poor gap growing. Now it's shown that there's so many people in the working poor, among the working middle class and the working poor, who just can't take off from work because they're working 2 jobs or their work won't let them take off and not get paid. This has to be compensated for. The government should regulate that and say to the employers, look, we'll help you, subsidize you, but you should give your workers time off to go get the vaccine with no penalty. We should definitely allow them to do that. That will encourage them to go, and that will get more people who are left out of the loop right now to be able to be brought in. And then also ethnic and racial minorities are in a situation where they're not getting vaccinated at the same rate as some of the other groups that have been. Asian Americans, for example, have the highest rates of vaccination. White Americans, the second highest rate. And African Americans and Latinos or Latinx are very low rates of vaccination right now for historic reasons and also cultural reasons. That has to be overcome. Absolutely has to.
Finally, you're a professor of political science. Is it your take, looking at the US and the rest of the Western world, we can talk for that a lot of countries will go with vaccination mandates to go forward rather than they'll take it out of people's hands?
They will go forward with it. In fact, France has already started and led the way on that because the French president made a decree recently that if you're not vaccinated, you can't show proof of it. You're not going to come into theaters. You're not going to be able to get on the trains or the subway. You're going to show in public places will be off limits to you, basically. And then there was a huge surge in vaccination when he made that comment. By the way, I should also go back and correct something. I meant to mention not just the people of color like the Latinos and African Americans, but also the low-income and rural white Americans who are working class and some unemployed Americans who are white who have been loath to get the vaccination. So we need to get all of America together on this. This is a national issue of patriotism to save this country's future for everyone.
Absolutely, and that's a worldwide issue. Professor Peter Mathews, I know our subject's been pretty strong today, but it's always good to talk. We'll be back on next weekend.
You bet. Thank you, Tim. Take care.